Compartment syndrome is a serious, at times even life-threatening surgical emergency that can lead to devastating consequences if it's not properly recognized and properly treated. I will be doing a series of videos to help us better understand what compartment syndrome is, what its signs and symptoms are, what are the diagnostic tools at the disposal of a treating provider, and then what are the treatments that are available. And then in my final video, we'll talk about the kinds of medical malpractice scenarios that I've seen in my practice when things go horribly wrong. So let's begin with the first important issue, which is, what is compartment syndrome? Now, in my experience as a medical doctor and as a teacher of medical students, whenever I want to discuss a medical topic or a medical condition, I try to always begin with the anatomy. So where does compartment syndrome occur? Well, classically, it occurs in either the legs or the arms. And what you need to understand about the anatomy of the arms and the legs is that there are bundles of muscles, blood vessels, and nerves that are aggregated together and surrounded by something known as fascia. The fascia is a fibrous tissue. Think of it as very strong saran wrap that kind of holds things together. It's a way to keep the anatomy all organized and working together in both the arms and the legs. But here's the problem. That fascia that I described, that tough saran wrap that wraps around muscles and nerves and blood vessels, well, it doesn't have a lot of elasticity. It doesn't have a lot of give. So if there's ever a situation in which there's swelling or fluid accumulation inside of that compartment, the compartment is that space that's occupied by the muscle and by the nerves and by the blood vessels and surrounded with this fascia. Well, if fluid accumulates inside of that compartment, or if swelling occurs inside of that compartment, then as you can imagine, as that fluid increases, it starts to exert pressure against all the structures that are found within that compartment. Now, initially, the muscle does pretty well with that kind of pressure. And even the nerves initially do okay with that pressure. But the blood vessels, if you think about it, they're just tubes filled with fluid. Well, as the pressure builds up inside of that compartment, what happens is that blood supply that goes into that compartment and sometimes even down below that compartment, that blood vessel, as it compresses and that blood supply dwindles off, think of it like if you had sprinklers as a part of your landscaping and somebody went and started to turn off the water that fed those sprinklers. Eventually, the grass that relies on that water is going to die. In that same way, as that pressure develops within that compartment, structures within that compartment begin to die. Now, that would include the nerves and the muscles. And if that fluid accumulation is not released, then within a certain window, the damage becomes permanent.